Hey everyone, Dr. Rodman with Sports Chiropractic. Today we're talking about if you have pain right here. We're talking about the inner knee, the medial knee, and some of the reasons why it can happen. Now, a lot of people know of some of the catastrophic reasons, like if you're planted and you twist and you hear a pop, you might tear your meniscus, you might tear your ACL. We all know of the catastrophic things, but we want to talk about more of the how did this start to happen, because remember, the knee, I tell people, is a good person with bad friends. The hip and the foot tell it what to do. It really can't move without the hip or the foot doing. So something's wrong in the foot or the hip will meet in the middle at the knee. And recently I had this problem, and that's why I kind of started looking into it a little more, as well as a lot of our patients having pain in the medial knee. So one of the things I found is that if your feet are flat, and I'm just going to exaggerate a little bit here, but your knee will start to collapse inward a little bit, and that puts a lot of loading and stress on that inner knee there, and that can jam it up or cause it to become painful. So that's one reason. One thing that I had was actually a higher left hip. So because my hip was higher, when I would lean on this side, it would jam not only my lower back, but also my knee got really compressed. And I've been doing a lot of standing, a lot more than usual, and I think it just started to build up. I also was trying out something called earthing, where you walk around your house and outside with no shoes on, and trying to get some of the charge from the earth to help with inflammation, trying that out. But I think just being barefoot a lot also collapsed my feet inward and caused some inner knee pain. So that was another reason, as well as switching to these low profile shoes, which are very flat. So I think all those things combined to lead me to have some knee pain without a trauma. So if you are having some knee pain, start to think, did I recently change my shoes? Have I been standing more? When I stand, do I really lean on one side compared to the other? So now what we're gonna do is take you to some of the structures and educate you on the knee. So if you wanna take a look here, we can kind of show you. So now zooming in on the inside of the knee, you can see you have a lot of stuff going on in just this very small area. The first thing is this long tendon here called the sartorius, which we're going to hide. And we have this one right here called the gracilis, which we're going to hide. And we have another one called the semitendinosus. Now those three tendons can compress this little purplish structure called the pes anserine bursa. And a lot of times people will have really pinpoint tenderness on the inside of the knee, and that'll be because of bursitis. And that's something, if we massage and push on, it'll actually get worse. So if it is bursitis, we usually ice that to get it better. So we're going to take that away, and we're going to look here at this long ligament, which is the MCL, which can sometimes become tight as well, and that can be problematic. Also surrounding the knee, you have the patella, the bone here, which can become painful if it's not tracking properly, or also the retinaculum that holds it in place, or the joint capsule actually can be really tight and pull that knee. So that's one of the most, I think, overlooked reasons for knee pain is tightness in the retinaculum or the joint capsule. And a lot of times people will go and find out that they've got arthritis and other problems, but the problem is really just the patella wasn't tracking right. But sometimes it can be an arthritic condition where if you look at the femur here, it gets really worn down, and or the tibia here, and that becomes more of an orthopedic type issue where you may need a surgery or something like that. And then also you look at the cartilage that lines the top of that bone, the meniscus, and that can get very worn down too. Sometimes the meniscus is not a surgical case if it's not torn or there's not a piece of it floating around, a fragment. It can actually just be because your tibia and your femur are rotated and it's torquing and causing a lot of shearing stress on that meniscus. So you can have meniscus pain that's not actually orthopedic surgical type issue, but it's more because your femur and your tibia need to be aligned a little bit better. So that is some of the structures of the knee. So I hope that gives you a better idea of all the things that are going on just in this little bit of an area right there. So, what we can do here at Sports Chiropractic is examine you, see if it is an orthopedic catastrophic issue, and if it is, we can make sure to get you in really good hands with the great orthopedic that can take care of you. But I just wanted to educate you that there's so many biomechanical misalignments and rotations of the knee, or a high hip, or flat feet that can cause knee pain. So it's not always a surgical issue. and we can help diagnose and treat that here at Sports Chiropractic. So if you're having inside knee pain, I hope this helps to educate you. Give us a chance, we'd love to help you out. Dr. Rodman, have a great day.